So this year at the ICS, one of the roundtable conversations that we'll be hosting is new treatments and minimally invasive treatments for male LUTs and BPH.
We are going to have a faculty spread around the world to have the flavor of different sides of the world, from Japan, from Asia. Professor Kakizaki, he will talk about the limits for medical therapy in a man with benign prostatic obstruction. Then Dr. Dean Elterman from Canada, he is an expert in minimally invasive surgical treatment.
I think this is a really exciting topic. There have been so many new technologies introduced on the market now. There are at least 4 different minimally invasive treatments that are now bridging the gap between medical therapy and surgery, and there's a lot on the horizon. So I hope at this roundtable discussion we'll be able to see how to best select patients and choose between these different types of treatments.
And then in the end we will have Enrico Finazzi from Rome. How to select patients. How can we select the ideal patient for the obstruction by surgery, or on the opposite, the ideal patient to maintain our medical treatment.
I think it's a very hot topic in this moment because apart from the usual drug therapy, we have now a list of minimally invasive treatments that can be used not only instead of, let's say, traditional surgical treatments, but also instead of oral drug therapy. So I think this is a topic that will be of interest for many participants of the ICS.
A topic that is not so much under the radar, which are the frontiers of the treatments, which are the frontiers of medical treatment. Sometimes, eventually, it can be prolonged too much, or it can stop too early. We don't know, we have to discuss that.
Male LUTs really fits well within the framework of the ICS. We all see patients who suffer from urinary symptoms, and BPH is really the most common symptom that men experience. So I'm really excited to be able to bring this type of conversation about new minimally invasive treatments to the ICS.
And the other point are the frontiers of the recently introduced minimally invasive surgical treatment for benign prostatic obstruction. And so the title of the session will be exactly Frontiers of Drug Therapy for a minimally invasive surgical treatment for benign prostatic obstruction.
I think this roundtable will provide the actual evidence on the different treatments that we may have. Some of them are very new. And I think it will be the opportunity to discuss the role and how to introduce these new treatments in our, let's say, treatment algorithm.
So 3 speakers, 3 important topics, and time for a good discussion in the end, I think.
The ICS is going to be a really fantastic meeting this year in Abu Dhabi. It's going to draw people from multidisciplines across the world, from urology, urogynecology, pelvic floor physiotherapy, and other disciplines. And it's really unique because you get this global perspective from everyone's different types of practices in different parts of the world.
So we have flavor from different parts of the world. And that is important because the practice in Japan is not exactly the practice in Europe or in North America or in South America.
Usually, and also this year, is the meeting of the year for those who are interested in the treatment of male or female LUTs, for those who are involved in the health of the pelvic floor, so gynecologists, urologists, physiotherapists, nurses, and many other professionals.
This session is the ideal to have all of them together, because it is not only for clinicians but also for the scientists to think about new treatments, new drugs, what still need to be investigated, and for the industry to understand if the new coming machines are working well, are doing what we are expecting they should do.
I think now is a great time to go online, check out the ICS website, see the program. It's really robust, extensive. It's going to be really interesting, and you can register today and join us in Abu Dhabi.